This video is on the cortisol DHEA ratio, and it's how it affects the pancreas and stores and can store fat. So we already covered, this is the fourth video, we already covered brain, stomach, and inflammation, okay? And so inflammation, of course, is part of that fat and weight loss thing. Now we're covering pancreas. Now the pancreas secretes insulin, and that could influence carbohydrates and be used for energy. But when this cortisol DHEA ratio is off, we could be storing fat, we could be storing lipids. So when that ratio is off, we might see a decrease in energy, an increase in carb cravings, like you just want the breads and you want the pastas. You want all the stuff we shouldn't be eating. And so that's a problem. And that creates fat storage. And so we want to eliminate that, and we want to fix this problem. In many cases, we'll have, let's say, a woman, so she's not able to lose weight. This can be part of the problem, or it can be the problem. So it also will, eventually, it will create insulin resistance, where the cells are resistant to insulin. And when the cells are resistant to insulin, that leads to type 2 diabetes, which is something we can control with our diet and exercise and doing the right things. Carbohydrates can be stored in a couple places as cholesterol and triglycerides. So sometimes we see that patient come in. They have, say they have normal cholesterol. Say their cholesterol is 200 to make it easy. And let's say their triglycerides, which should be 50%, if the liver's doing its job like it should, the cholesterol, say, would be 200, and then it would be 100. It would be 50% of the cholesterol. So let's say a patient comes in and we see 200 on cholesterol and we see 350 on triglycerides. Well, we need to start thinking about this type of problem that can be going on. It also can elevate body fat. So as we look at the chart here, lipid storage can store fat in the abdomen and the hips. Now in men, we see typically in the abdomen, right there, and the neck. So if it's in the neck, that can lead to a couple things: sleep apnea. And so if this ratio is off, we can see that. Or it can lead to prostate hypertrophy. And so we need to be aware of those things. The end result, when we see this here and we see this here, the end result could be heart disease. Now, females are a little different. Females, it can store in the abdomen, hips, and triceps. So that female that can't lose weight, or that female that can lose weight, but she's not losing here, that can be a problem with this ratio, cortisol DHEA ratio, and how the pancreas works in all this. So when we see that fat here, that's a sign. A medical doctor, I can't even pronounce his name, he taught us a long time ago, that's a sign of estrogen dominance. We were at a conference, and that was part of it, and that's a sign of estrogen dominance. And so we've been doing that for a long time, looking at this and seeing if women might have estrogen dominance. So a lot of women are on estrogen, and yet they have this, which, that's something we want to get control of our health and lose the weight and get them in shape. Also, when we see that in the hips and the abdomen, that's why we have our lipomelt machine, which is infrared and near infrared laser that lays on the patient and can help us melt that fat. Because some women, they'll get all thin here, but they'll still need help down here. And so that's what lipomelt's for. And so the cortisol DHEA ratio can affect the pancreas, store fat. That can be a problem. So until next time, reclaim your health, reclaim your life.